want to talk about thyroid today. Thyroid is very complex, and so I'm going to try to simplify it for you. But there's four different things that can go wrong. Okay, and so I want to make sure that you understand all four of them. And we see so many. We see so many of them in the middle, and the middle is where most menopausal women or hormonally challenged women have the biggest problem. Now, what happens when you start going into menopause, or you start becoming hormonally challenged? When you start your ovulation starts to sputter or stop ovulating, is that the first set of hormones that become imbalanced are the progesterone estradiol ratios, and that causes a lot of different symptoms. And then as that goes on and it doesn't get taken care of, the thyroid becomes overburdened, and because of the thyroid becoming overburdened, it starts to tank. But there's, it's one of those kind of things that doesn't show up in tests. And so I'm going to explain to you what you really want to look for when you look at thyroid testing. Okay, and then there's another problem that happens, and I see more and more of this, and I've seen so much of it, but no one looks into it. And that has to do with heavy metal poisoning, like mercury and lead. It has to do with mold poisoning. It could be viral. It could be bacteria. There's different things that doesn't allow the cell to uptake the thyroid hormone. And then the fourth thing that happens in an autoimmune disease, and the autoimmune disease of the thyroid is called Hashimoto's. And so I want to get into that. When I see, 15 years ago, when I went from just helping women lose weight to helping hormonally challenged / menopausal women lose weight, I started seeing a lot of Hashimoto's. And so we want to talk a lot about that. It seems to have gotten better. 5 years ago, let's say, Hashimoto seemed to be epidemic. Now I'm not seeing it show up as much as it was 9 years ago or 10 years ago. 15 years ago, I saw a little bit. So it's kind of had this little bell curve in which, it seems like it is getting better. The Hashimoto's is not showing up so much on our testing. Okay.
Zach, I don't hear you. Unmute yourself.
Okay. Keeps going.
There you go.
Muting it.
Okay.
Keeps muting itself. There we go. Okay. So let's get into it. We're going to start from the top and work our way down. Okay. The first problem that we usually see is what we call the HPT axis. It has to do with the hypothalamus, the pituitary, and the thyroid. Okay. There's three things that happen here. Is that the hypothalamus is the thermostat, and it measures how much thyroid hormone we have in our bloodstream, and it will release different kinds of hormones to stimulate the master gland, the pituitary, to release more hormones. And so it releases if there's not enough thyroid hormone in your blood, it's going to release a hormone called thyroid releasing hormone. And thyroid releasing hormone is going to go to the pituitary gland, and it's going to say, hey, buddy, you don't have enough thyroid hormone going on here. And so the pituitary gland is going to release a hormone called thyroid stimulating hormone, TSH. And then TSH is going to go to the thyroid, and the thyroid is going to release a hormone called T4. Okay, T4 is tyrosine, an amino acid with 4 iodines attached to it. All right, that's called the HPT axis. Now, what we want to see is the thyroid. Most doctors only pay attention to TSH. Okay, and this is one thing I want you to know about TSH, is that TSH is a measurement of the pituitary gland, but normal for TSH used to be 0.5 to about 2.5 in our grandparents today. Now, normal is what 80% of the population is. Now, since our grandparents, since then, normal has widened because we've gotten sicker, especially our thyroids. And so instead of it being 0.5 to 2.5, now it's like 0.5 to 5. Okay, so again, normal is 80% of the population. That's how they determine, what is normal. So 80% of the population is measuring between 0.5 and 5. Okay, and so they're considering that normal. Though, in our grandparents' day, it was measured. The normal was more like 0.5 to 2.5. Okay, so that's where we get in a lot of trouble. Abnormal is 10% below and 10% above. Now, if you're below 0.5 TSH, you're considered hyperthyroid. Okay, and if you're above 5, then you're considered hypothyroid. And so when you get into this 0.5 to 5, and you're going to be told you're normal, that your thyroid is normal. And this is something that really bothers me. It bothers me a lot because, the ideal is around 1 to 1.5. And, if you get above 2, you're really getting to a sluggish thyroid status. And so if you get up to 4 and you're considered normal, back in the day, you were hypothyroid. Okay. And so when you're looking at TSH, okay, when they survey people that feel the best have about a 1. Okay. 1 to 1.5. Those are the people that feel the best. And what I mean by best is that they have energy. Okay. They're not losing hair. Their skin looks well. They don't have intolerance to heat and cold. Their hands aren't hot and cold. Okay. Their eyebrows are not losing it. Okay. So that's where you want to be, is your TSH wants to be around 1 to 1.5. That's ideal. 2 max. If you get above that, you better start working on your thyroid. Okay. So again, this is a measure of the thyroid stimulating hormone, which is coming from the pituitary gland. All right. And so now, that's the first test. And that's, many doctors, that's the only thing they test. And it has a lot to do with this because there's a reason. Because even if your other ones are odd, it doesn't change their treatment program. They only have 2 forms of treatment when it comes to your thyroid. Okay. If it's low, if you're hyperthyroid, they're going to destroy your thyroid. Okay. They're going to, use radioactivity. They're going to use surgery. They're going to destroy the thyroid. If it's too high, that means you have hypothyroidism. They're going to give you levothyroxine, Synthroid. Was the brand name. Now it's generic at levothyroxine. And so that's only 2 forms of treatment they have. So therefore, why do a bunch of different tests if that's what the treatment is for thyroid? But there's so much more you can do, so much more. Okay. And so the second hormone you want to look at is T4. Now, T4, like I said, is a tyrosine, which is an amino acid, which is a piece of a protein with 4 iodines are wrapped around it. Okay, this is going to be released by the thyroid gland, and when it's released by the thyroid gland, what you're going to see is this T4 go out throughout the body, but it doesn't do anything. Okay? It's kind of an inactive. It's kind of like a pro-hormone. Okay, I always think, what's it good for? Absolutely nothing really. Okay, so when you're looking at the T4, you want to look at the free T4. Okay. Now, let me explain to you what a bound T4 and a free T4 means. Hormones attach to proteins, and some of these proteins bind so hard to the hormone that the hormone is worthless, becomes inert in essence. And so free hormones are the hormones that the body can actually use. And so we want to look at the free T4. Now, what we have found is that people feel their best when they have a free T4 that's in the upper 50% of normal. Okay. We have found that those that in the bottom 50% of normal, okay, don't have very much energy. And so you need enough. So you want that T4 to be up in the upper 50%. Okay. Now, the T4 is going to go to the duodenal system, and when it goes to the duodenal system, it's going to, and with the duodenal system, like the liver and the gut, primarily the bacteria, and in the gut, and the pancreas, but it's going to cleave off one of those iodines, okay? And it's going to turn it from a T4 to a T3. Now that's the active form of thyroid, T3, all right? Now, we don't want to look at the bound T3. We want to look at the free T3, all right? And the free T3 is going to be that hormone that the body can actually use. Now, when we wanted the T4 to be in the upper 50%, we want the T3 to be in the upper 25%. Now, T3, what is it? It is the spark plug, okay? See, in every cell, there's these little organelles called mitochondria. They're actually ancient bacteria, okay? And what this mitochondria does is it turns our fuel, the food, into energy. And what happens is the sugar, let's say we'll take glucose, it will go through the membrane, it go into the mitochondria, and there the T3 is going to create a combustion of the sugar, and it's going to form ATP, okay? And this is your energy. So T3 is the spark plug that combusts the fuel, the glucose, and makes energy out of it. So you can see how that becomes very important. And the more mitochondria we have, the more energy we have, but the more T3 we have, the more energy we have also, okay? So you want to look at the free T3, and you want it to be in the upper 25%, okay? This is where I see 80% of the problem. 80% of the problem is in the conversion of T4 to T3. Now, no one looks at that, all right? No one looks at what the conversion ratio is between T4 and T3. Well, this is where we see the big problem is if your T3 is low, okay, and your T4 is high, okay, you have a conversion problem. And this has everything to do with the gut. And so it's very important that if you have low energy levels, you take good care of your gut, all right? Very, very, very important. Okay. Now, the next thing that happens is now the T3 has to get into the cell. Okay, it has to get through the cell, get into the cell, get into the mitochondria, and that's where it works as a spark plug. Okay. Now, if you have heavy metal poisoning like lead poisoning or mercury poisoning, you're not going to be able to get in the cell. If you have what I see mold, one of the things that very few people have and don't realize that's causing them to feel so sick is mold, okay? Mold creates such havoc. If you live in an environment that's very wet, very humid, you probably have a lot of mold in your body. And so you have to you have to clean that mold out of not only your environment, and out of your body, or that T3 won't get in. You could have an excellent free T4, an excellent free T3, but none of it's getting in the cell because you have mycotoxins, mold, or you have heavy metals, or you have some kind of bacteria, or you have some kind of virus. Okay, you could have Lyme disease, for example. You could have these different West Nile disease. These things are going to create, problems where the T3 is not going to be able to get into the cell. But the one that concerns me the most, or the two that I should say concern me the most, are the heavy metal toxins and the lead and mercury poisoning, cadmium, and the mold. And when we have that, we have resistance to the T3. Okay. Another way we can have resistance to T3 is just having fat. Okay. Too much fat will cause resistance. Just like it does to insulin, to leptin, it will do also to T3 when there's too much fat in the cell. Okay. So when you're looking at your labs, you want to look at the TSH. You don't want to look at normal, okay? Because normal people in America are sick. All right. You want to look at optimal. And so TSH is optimal between 1 and 1.5. That's where you want to be. So if it's not there, work to get it there. Okay. You want your T4, your free T4, to be in the upper 50%. That means you have plenty of T4 floating around. Okay. You want the T3 to be in the upper 25%. And the reason being is that means you're converting the T4 correctly. Okay. And then you want the uptake of the T3 to be optimal. They are starting to measure some uptake, but there's a lot of controversy about this test, if it really measures uptake or not. Okay. Now there's another test, kind of an optional test that I would recommend. And what that test is reverse T3. What is reverse T3? If you're stressed out, if you're in fight or flight, okay, there's going to be all this T3 that's going to be released in your body because you're going to need energy. You're going to fight off a tiger, you're going to run from the tiger. Of course, this could be, because you're working in the ER room. This could be, because you're out, on the streets of New York as a police officer. These things are like, you're always in fight or flight when you're working in an ER room and you're beating the streets in New York as a police officer. You're always in that state. Well, if something happens, let's say that, you have an emergency in the emergency room, or all of a sudden, you have an artery that's just leaking blood and it's just shooting everywhere, or you have a bad guy that has a gun that's shooting around. Okay, what happens is your body knows you need all this T3, and so it starts converting those T4s into T3. Now, what will happen is if there's so much T3, you could have a heart attack. And that's why some people will have a heart attack from a shock. Something, dramatic happens. Like 9/11, you see something like that immense trauma, okay, releases so much T3 that your heart just shuts down. So what the body does is it makes a reverse T3 when this happens. And what a reverse T3 does, it's like T3, but what it does is it blocks the receptor sites so that you don't have so much T3 going into the cell all of a sudden. Okay, and that's called the reverse T3. Why would you want to measure that? To see how stressed out you are. If you're under stress all the time, if you're a police officer, if you're an ER nurse, you could be possibly stressed out all the time. You want to see your reverse T3. Because what ends up happening, if you're stressed out all the time, you have all this reverse T3, it's blocking your T3. Your energy levels are going to plummet. Even though, there's not like a serious thing happening at the moment. And so you want to look at that reverse T3. In essence, it measures how stressed out you are. The next thing that I want to talk about when it comes to thyroid is Hashimoto's. Now, like I said, I'm seeing a bell curve happen here. I haven't been seeing as much as I did, 5-10 years ago. I saw so many of my clients have Hashimoto's 5-10 years ago that I thought, oh my gosh, everybody's going to have it. Instead of seeing it 70% now, back then, like I did then, now I'm seeing it more like 20%. The way you measure Hashimoto's is a test called TPO, thyroid peroxidase. It's an antibody that's released by the thyroid. See, there's two theories here. They all have to do with food particles, particularly gluten. Okay, let's say that, and as you all are finding out, is that most hormonally challenged women have a problem with gluten. It'll make you sick. It'll make you fat. It makes you it drains you of your energy. If you go out and you have gluten with sugar, go have a muffin or a cake, you don't feel too hot afterwards, particularly the cleaner you get. Well, what happens is if we have a gut that can't keep gluten within it, and meaning that the epithelial lining, which is the cheesecloth of our body. See, we have a cheesecloth that goes through our tube. We're nothing more than a tube. This cheesecloth, called the epithelial lining, which is actually made from the same cells of our skin, it's only one cell thick, and it protects us completely from the environment. Okay. If it starts to leak, and there's two reasons why it leaks. One reason is we get a bacterial infection. When we have an overgrowth bacteria, the bacteria will colonize. When it colonizes, it will form biofilm around this colony of bacteria. This biofilm is like a shield. That's why they're called superbugs now, okay? Because they colonize, form a shield, antibiotics can't get to them. They'll release a compound called zonulin, and zonulin will loosen the tight junctions of this cheesecloth, the epithelial lining. And because of that, food particles will start to pass through. Now, gluten is never supposed to pass through. And the reason being, it's a really large protein. And so when it gets through, and it's also very inflammatory because it is a lectin. And if you ever listen to Dr. Stephen Gundry, he tells you that's the cause of all inflammation. And he may be right, because it seems like when we pull lectin foods from people, they get well almost overnight. And so what happens is a piece of gluten will get into our bloodstream. And when it gets into our bloodstream, there's two things that happen. One is that there's an antibody made by the immune system against gluten, okay? And so if that occurs, what we have is what we call molecular mimicry. What I mean by that is gluten has very similar molecular structure to the thyroid cells in the gland, okay? And so what we have is an antibody that's out, like a soldier that's out looking for a piece of gluten. And what it does is it finds the thyroid gland instead, and it starts attacking the thyroid. When it starts attacking the thyroid, it eats it away. It starts destroying the thyroid. That's one theory, okay? It's called molecular mimicry. The other theory is that the actual gluten embeds itself in the thyroid gland. And by embedding itself in the thyroid gland, then the thyroid gland releases messengers that tell the antibodies to attack it. Okay. Either way, what Hashimoto's is that there's an actual bombardment of the thyroid gland, and it's being eaten away. And the bad news is it's being eaten away, meaning that you can't reverse it. Once it's eaten away, it's gone. And so the thing you want to do with Hashimoto's, you want to slow it down and stop it. So how are you going to do that? You're going to have to stop eating gluten. And I have seen studies where one molecule of gluten that gets into the bloodstream can set someone's thyroid therapy back 6 months. It'll take you 6 months to get back to where you were, okay, after you've been gluten-free for quite some time, from one molecule of gluten. And so, that's the first food that you want to make sure that you're not touching is the gluten. Sugar, same thing. You don't want to be touching sugar if you have a thyroid problem, all right? Also, dairy. Dairy and thyroids don't mix. And so you have to start playing around with these foods, because we have these, you've heard of goiters. There's food that will make goiters. They're called goitrogens, and you might have to avoid those. There's nightshades. If you follow football, Tom Brady swears up and down that why he has done so well for such a long time is his diet of avoiding all nightshades, particularly tomatoes. Okay, those things can affect your thyroid gland, and so diet is so very important to your thyroid gland. Also, what's going to be very important in your thyroid gland is making sure that you have the nutrients to make the enzymes that cleave off one of the iodines from the T4 and make T3. Okay, and those two are selenium and zinc. Okay, now if you're having a problem with the thyroid, okay, you want to be looking at iodine. Okay, and because if you don't have the tyrosine, the amino acid, particularly if you're a vegetarian, you need to get that tyrosine in there to make sure you have enough of those, and you have to have the iodine in there to make sure you have enough of those to make it T4. Okay, the best way I like getting my iodine is by using kelp flakes, but you got to make sure nowadays that these kelp flakes don't have any radioactivity to it due to the fact that there are major radioactive spills into our oceans. Okay, so anyway, quick review. Thyroid releasing hormone comes from the hypothalamus, tells pituitary gland, okay, to release to release thyroid stimulating hormone, which then goes to the thyroid gland, which is located right here, and it actually looks like a butterfly. It's actually, the word means shield, I believe. Okay, and then the thyroid gland releases a hormone called T4, which is not really a hormone, it's more of a pro-hormone, inactive hormone. Then it goes to our gut, and in the gut, one of the iodines is cut off, and that activates it by turning it into T3. Then the T3 has got to get into the cell and into the mitochondria, and then the T3 works like a spark plug, and what it does is convert the glucose into energy, okay? So we have a pathway you have to go here. Primarily only test the TSH. And because the normal's gotten so large over the last couple of generations, always keeping around 1, because that's when surveys show that people that have like 1 TSHs have the most energy. So I like 1 to 1.5, okay? With a T4, upper 50%, T3, upper 25%, okay? You also want to make sure your TPOs are non-existent. That's the thyroid perioxidase. Those are the antibodies. And so when you look at a test, just don't believe that you're normal or don't accept that you're normal. The thing you have to look at when it comes to thyroid are subjective complaints. Okay, one is weight gain, one is weight loss resistance, the inability to lose that weight. Okay, but the big one is the marked loss of energy. If you're having a thyroid problem, you're having an energy problem. You're also starting to lose some hair. Okay, when you have a thyroid problem, your skin's going to change. It's going to start aging. Okay, it's going to get crepey. It's going to get dry. It's going to get crinkly. Okay, you're also going to have cold hands and cold feet, and you'll have an intolerance to heat or cold, meaning that it's got to be just the right temperature. Okay, if you have a man with you or a partner with you that's saying, "Man, does it always have to be this freezing?" Think again, thyroid, also your progesterone to estradiol ratio. Okay. Also, you'll lose the lateral edges of your eyebrows. Okay. If you're starting to notice you're going to have permanent makeup put on your eyebrows because they're just not like they used to be, again, think thyroid. Okay. The best way to treat thyroid is to work with your diet and work with supplementation. But if there's been destruction of it, you're probably going to need some medication. Keep it going. Okay. Well, it's telling me that I'm out of time. Yeah, it's already that time. So if anybody has any questions, I'll open up for questions. If not, just unmute yourself and ask a question.
Doc, are any of those thyroid supplements that they advertise, are those good? If you're kind of off with your T4s and your T3s, do you recommend them?
You know, yes and no. I was in love with them 40 years ago. They primarily come from, they're pig glandulars is what they primarily are. They're actually thyroid gland that comes from, now I'm talking about, the glandular part. That's what usually most people are thinking when they're thinking of thyroid supplements, are the thyroid glandulars. What I found is most of the time when I do my surveys with my patients back then, is I found that they didn't have much difference. But when they did, that was exciting. But I saw the majority of them didn't. I found that it was more particularly as a woman aged, that the most important part was a conversion of T4 to T3. And so we have to work more with the gut. And so, we have to cleanse the gut, we have to heal the gut, we have to re-inoculate the gut to get a good conversion rate. We also have to make sure we have the nutrients there to help to make those enzymes, because many menopausal women especially are low in selenium, and they're also low in zinc. Now, selenium and zinc are kind of weird, because they should never be used long term. And like even today, I found someone who possibly has a zinc sensitivity. I found someone last week that had a zinc sensitivity. I literally have to, tell them to stop it, because I don't believe in any adverse side effects. When it comes to supplements, if you don't feel better, then don't waste your money with it. If you feel worse, stop it immediately. Throw it away. Okay? Okay, it's supposed to make you feel better, and I don't believe that. Oh, you're just detoxing. Nah, you know, if it's going to make you feel better, you're going to know in a week or two. And so, the glandulars are one of those things that, yes, when it works, it's awesome. I just don't see it work that often. Does that answer your question?
Okay.
And you'll probably notice in our thyroid course, I don't even introduce them. They're very controversial. First of all, you know, you're eating a pig thyroid. To me, I don't know. But again, I have used them, and I would use them if the other methods didn't work. You know, it's kind of like how I use maca. I use it with menopausal. When other stuff work, you probably noticed in my last course, in my menopause course, is maca. Okay, because it's controversial too. When it works, wow, it's like a cure-all. And so that's what I'm saying. If you still have the hot flashes and night sweats and all these different symptoms that go along with menopause, if they're not gone, which they're usually gone in the first couple of weeks on our program, if they're not gone by week 13, okay, then here it's time to try maca. I take maca because I lift weights. I do it primarily for the weightlifting. It does wonderful things for my weightlifting. Any other questions? Okay, well, I'll be back next Wednesday. Invite all your friends. We didn't have a huge crowd today, but that's okay. I get a lot of views of it after I post it, so I know that most people depend on me posting it. They take the chance, though, because technology doesn't always work. So anyway, God bless you. I hope it's a lot nicer wherever you're at than it is here. We've had the heat wave, we've got fires. It's horrible looking outside. We can't even, if there's one time to wear a mask, even if you're not around people, it's today, because I literally went for a walk today and there was so many ashes in my hair when I got back. That means I was breathing that all those ashes into my lungs, which is not a good thing. And so I'm just going to stay in for the rest of the day because it's really ugly out there. Some great sunsets going on though. There's beautiful pictures all over social media of these beautiful sunsets going on because of these fires. But I think we got like over 40 fires around us, just dropping ashes everywhere. And we got 108-degree heat, which is never any fun. And it's been unrelenting. It's been every single day. So anyway, God bless you. Stay safe and, eat great, think great, get a little activity in there. And just